with Mr. Basil Ottley. And I'm just going to give a brief introduction of Mr. Ottley. He's the Policy Director in the Office of Insular Affairs at the Department of Interior. He previously served as the Virgin Islands Desk Officer at OIA, as well as he was a Senator in the 27th Legislature of the Virgin Islands. He's worked tirelessly with the federal agencies, with NHIT, and the relevant local agencies for those 2 years to bring this summit, which OIA, the Office of Insular Affairs, is sponsoring, to fruition. And we want to welcome him and thank him for his support and the sponsorship.
Good morning, everyone. Good morning, Lieutenant Governor Roach. Good morning, Senate President Francis. Good morning, my good friend, Delegate Plaskett Chizune. Incredible job in Washington. We couldn't have a more diligent advocate in Washington pushing for the issues. So thank you for your service. Thank you, all of you who have showed up here today for an occasion, an event that we thought it was very important to get behind and support. After Hurricane Irma and Maria hit the Virgin Islands, I think the world turned for all of us. We in Washington came in not too late after what had happened, and I can tell you it was heart-wrenching seeing the condition that our people were facing, especially from a health perspective. And we got on the ground working with our partners from HHS, and immediately what we came to a consensus was the lack of institutional capacity even before the hurricanes that were plaguing the move forward and bringing everybody together. As we sat in workshops trying to figure out, okay, what are the priorities? Where do we go from here? It became immensely real that we had competent people working in different divisions who weren't talking to one another. Doing amazing work in health, in human services, at the universities, at the clinics, but nobody was sharing information, nobody was coordinating, and that was very disturbing. I think we understood when we shipped off a number of our residents to the States, how that gap in the lack of communication was so critical to ensuring the health and safety of our residents. And so when we moved through the different processes, bringing people together, having some difficult come to Jesus moments, we understood that in order to keep the progress going, we had to invite nonprofits to the table to help keep the momentum going. And why is that? Folks at the Department of Health, Human Services, and other government agencies, one, are victims themselves, trying to move forward, as well as they have regular operational things going on that they're just trying to get their arms around. So when you start talking about something that's transformative, who are you going to rest that responsibility on to make sure that the broad perspectives, the dots and the I's that are necessary to keep those things going, who's going to cover that? You're going to put job 4 and 5 on the people who are ready, are in the trenches? And so we were very happy to see Louis and Donna stepping up to the plate and other organizations to say, hey, we are here to bridge some of that gap, to make sure that this tremendous work that was done during the recovery time is not lost, and we can keep the momentum up. We talked with our colleagues at HHS and identified that there was that $14 million and a little more available at CMS to fund the electronic health exchange program and the process of building IT connectivity here. And they said, but there's some gaps. We need something that will bring Virgin Islanders together to demonstrate that there's a commitment in the territory to move forward. And we said, well, hey, we at OIA can probably help with that. And Louis and Donna harassed me for a while. They came up to Washington. We saw an opportunity to provide some funding, and here we are today. And I got to tell you, congratulations to everybody that has been fighting the good fight to push this process along. Now, I got to tell you that the mission, they said, is to create a system of sharing of information here in the Virgin Islands, like what exists in the United States. And, you know, I've had some recent health issues that have brought me and given me full perspective of what the power of electronic medical records are. And I don't know now if I'm going to continue supporting this effort in the VI based on what I've experienced. And I'll tell you the story. In February, I went to urgent care because I had extreme pain in my ankle. I thought I had torn a ligament, a tendon, something. Went to urgent care, sat there, they did x-rays and everything. The doctor came, he said, "Mr. Ottley, you got gout." I said, "Gout? How the hell?" You know what I mean? I was very surprised, and he said, "No, you got it." So he said, you know, they gave me a little write-up and everything, took the test, and he said, "Hey, do you want us to send this to your primary doctor?" I said, "Yeah, good, go ahead." And after having that kind of pain, I was out for a week. I avoided everything that they said would impact and bring back an episode. I went to American Samoa and they created a great feast for us. They had roast pork, lobster, crab, beef, everything. Everything that I could not have. And I resisted because I remembered that pain that kept me out of work for a whole week. Well, months go on and everything like that. And you know, we think we could bust a little teeth hair in there, right? So I bust a little teeth hair in there. Bam! Another episode. My wife got rushed me to urgent care again. So again, he said, they said, "Well, hey, you need to do a follow-up test. You need to go see your primary doctor." I said, "Okay." Call my primary doctor. He wasn't available. The healthcare group that I belonged to sent me to a different doctor. I went to her. She took some additional tests and everything like that. I said, "Good." I listened in on a teeth again. Another episode. Now this time my wife said, "You need to go to your primary doctor." Go to my primary doctor and finally get an appointment. And he said, "Okay, I see here from your medical records that you were in urgent care these days. I see that you had an x-ray done also. The x-ray was fine. I see that this is the medication that they prescribed to you. And I also see that you went to one of my colleagues at another site, and here are the notes that they wrote. And I also see that the lab results that came from urgent care." Now remember, urgent care is a separate entity, private entity, from my primary doctor. But he's seeing all of the information, the doctor's notes, everything. So he said, "Okay, I'm gonna give you some things that you need to follow. I'm gonna write you some notes. I'm gonna send you some links so you can be better informed of what to do and how to deal with this." I said, "Good, this is wonderful." Now I get home, and my wife isn't taking my word for it anymore that I could do everything in moderation. She said, No. I want to see what the doctor sent for you." She said, "You open up that medical record so I can read." And she sees everything. She saw the diet, all of those type of things. So now it became a family effort to limit my independence. So the other day, I go to Target with my last born, this is the child who I used to get up at night to feed her and everything like that. So we have a special bond. So I try to do a little teeth again. I get home, she tells her older sister, "You know, Daddy went and buy so-and-so and he's supposed to have that." My oldest daughter tells my wife. So before I get down to the cupboard to get my little teeth, everything gone. And this is an expression of how the power of electronic records, what we are trying to pursue. can change our lives in some personal, but then some amazing ways. Imagine if we had that system in existence when we moved patients from the Virgin Islands. Their records would follow, as well as we would have an opportunity to track where they were in real time. Imagine once we get the vital statistics and all of these things connected, if in a school you begin to see that some children are having intestinal problems in that school, you can look and connect to see, well, where are these children living? The information becomes extremely powerful, especially in places with limited resources. Imagine if you tied who are your most expensive patients from Cigna Insurance, and you can understand something about where they're living, what their habits are, the ability to now pinpoint direct treatment to those people to bring down costs of everybody becomes an opportunity. That is why we felt so committed to support this project. I want to congratulate all of you who are participating to make sure that this opportunity does not die and wither away, but it becomes a truly transformative experience for the people of the Virgin Islands. Thank you very much.
Thank you. Thank you, Mr. Ottley, and thank you for that bit of personal experience to bring the whole message of what we're doing today home. Before I introduce